Right. Dr. Ashiru.
Hello, GMD.
Yeah,
How are
welcome.
you?
Okay, I'm good. I'm good.
Good.
Yeah, welcome. So, to our viewers, this is the news rechecking.
Right.
We're saying we're putting it under the Swap TV. So, Swap TV came out from Dr. Dobra. He said you need to make it Swap TV. So,
Right.
so it is.
Interesting.
But the objective is to use this as a platform to let people connect with the reform.
Mhm.
And then also help them to understand where you are coming from, where we are going, and also see instead of the work done. So that the reform, depending on what part of it people are working on, some of these things will manifest in good time. Some of them they take a little longer.
Right.
But wherever we are, people can see where to hang on and leverage reform.
Right.
Um, we need Nigerians to relate properly with this ongoing work so that they can take advantage of it and then move from there.
Mhm.
So that's the reason we have you here today.
It's my
So
pleasure.
please, while we know you, I think it's important for those who are out there to know your name and what you do in the reform and probably your role.
So viewers, my name is Dr. Ashiru Adamu Abubakar. I'm technical assistant to the Honorable Minister. And here in the SWAP office, I lead the governance, coordination, and state engagement.
Okay. What does that mean?
So-
Governance coordination and state
Right.
engagement.
Right. So I think I want to just give a little background.
Mm.
When the minister came on board and said he wanted to run health reform, but to anchor it on the sector-wide approach, I told people, I'm not sure Dr. Pate is ready for what will follow. Because knowing Nigeria the way it is, a federating state with 36 different entities, and now with local government, Supreme Court judgment, and each of them feeling that I am autonomous and working through a sector-wide approach, a reform that requires everybody to certain extent leave your affiliations and come and rally around a common goal. It's almost an impossible task. And when I was having those thoughts, never did it ever occur to me that would be my problem to solve.
Mm.
And few months afterwards, he invited me, which is a big honor for me, to come contribute to the reform and also to anchor that thing that I feared most for him in the reform.
So it became your problem.
It became my problem, literally.
Okay.
So governance, when you look at the reform, the first pillar of our reform is driving effective governance in the health system. Making sure that we work towards getting provisions of the National Health Act achieved, bringing citizens' voices and accountability in the center of the conversation so that we are not planning in the vacuum, but also strengthening cross-functional governance within the sector. And in so doing, making sure that we are listening carefully to the unheard voices, whether from the state, from the local government, from the communities, what this reform means to them, and to effectively work towards addressing those concerns so that everybody feels carried along and together we are moving in one direction.
Should I say your job then is to listen to everybody, like 200 million plus Nigerians?
Absolutely.
Okay, that's a lot of listening.
That's a lot of listening. So that's why I'm getting some additional gray hairs all over.
It's interesting. I know that when you spoke about the federating units, and the fact that, everybody may have their own direction in terms of maybe driven by the intent of the governors, executive governors at the state level. In order to drive this, I think there's something innovative that had to happen
Right.
in the creation of your office.
Mhm.
And by extension, using that mechanism to rally states behind the reform.
Right.
To start with, what has been your experience, forming that and then operationalizing it? Because I know it's something new. Every time I personally reflect on it, I know there's something new about that. It's not like we don't have a federal institution engaging the state, but within this construct of the sector-wide approach, what has been your experience?
So I think now a couple of them really. First, every morning I live with gratitude to God. When I reflect my journey before now, I feel like all that I have gone through was literally God was trying to equip me for taking on this challenge. Before now, most of my experience had been, of course, worked within government, the hospital, the community, with civil society organizations, with implementing partners, with government, advising governments largely on how best to make the most use of their resources as a technical assistant person. And when you pull all those things together, you realize I've gotten some of what is needed to start making that journey. And at the center of aligning the actors from the state, the community, and what have you, is one thing that we have for long not focused on, and that is building trust. For you to get people to move in the same direction with you, they need to be completely aware and understand that you mean well, you will not deceive them, and they can trust your judgments. But from the first time that you go in, and whether at the state level or federal level, and people realize you are only after your deliverable, you care less about the system, but your deliverable, you've lost it. I used to tell colleagues in terms of key things that one has to get for technical assistance. Yes, you have to be available, because no matter how knowledgeable you are, if you are not available, then it means you cannot contribute your technical skills to the people you are supporting. Of course, you need to be knowledgeable, because if you are available but you don't know what you're doing, you are not useful. But you also need to be flexible, because many a times the requests that would come to you in driving reforms may be off your schedule, among other things. So for me, understanding the direction of travel, understanding that even before I joined, a number of steps were taken to begin unifying the health system. Because for the National Health Act, 10 years after, one of the major barriers to implementation of the National Health Act is the fragmentation that exists, both vertically and horizontally. Vertically meaning from the federal, state, local government, everybody doing his own thing. But horizontally at the federal, horizontally at the state, the ministries and their agencies, everybody rubbing shoulder to shoulder.
Hmm.
So that lack of cohesion and development partners pouring their money, getting their results and moving out, irrespective of whether a sustained result will be gotten or not, and whether the priorities they are focusing truly reflects the priorities of the people or the states they are supporting, had made the implementation of National Health Act very cumbersome and ineffective. So before joining, understanding that already there is a tool that tends to unify the core actors, the states, the federal government, development partners, to say we are moving, we are committed to moving in the same direction based on certain principles, I think was an important shift to begin solving that thing that I feared the most. So coming on board, for me, it's for me to consolidate because the platform is there. There is some consensus with the Nigerian Governors Forum working from the side and what have you, saying that we have worked to midwife this discussion. And so for us, it's always trying to rally round the actors around what binds us together, that is the compact, but also doing that in a space that they know whenever we communicate, whenever we reach out, we're really doing that because it is important, because we truly value the relationship, and we truly want this to help us improve the goal of the reform, which is to save lives, reduce physical, financial pains, and produce health.
Thank you for quickly bringing the space the reform is meant to feed into,
Right.
which is the goal, to save lives, reduce our physical financial pain, and also produce more health. In terms of, I would like us to talk to about challenges. But before we spoke about, the challenges to getting there, because if it wasn't challenging, maybe people would have done this earlier.
Oh, yeah.
And then more importantly, if it wasn't challenging, maybe you just come in, solve it, and just walk out of the room. But before we go there, what are the gains? You've been at this for well over a year. It's almost gone 2 years cycle now, right? Because it is governance, right? Governance is typically an abstract construct.
Yep.
It's not like ambulance, it's an abstract thing. As a matter of fact, how do you communicate abstract to a baby and to a 5-year-old? They will say if you can't explain to a 5-year-old, it doesn't make sense. But how do you tell a 5-year-old about governance? So now how much more the rest of society also, where people actually want to see the tangible effect of the presence of a president in office, a minister in office. People want to see hospitals, they want to see this. But then here we are talking about governance, and as the first pillar of the reform. What are the gains? Things that might be tangible or intangible, but these all attempt at aligning the whole vertical and horizontal actors.
So I think if you remember, I mentioned some of the principles that effective governance will really rely on. But I think within the last 1-2 years, we're gradually seeing a lot more alignment, because immediately when we started this conversation beyond the compact that was signed between the governors, the development partners. We engaged because we came at a point, when there are a lot of stories of what the reform is, what is not.
Just people presuming what they are.
So people were creating dangerous stories about, with this one, the minister will sack this one,
Oh.
Pull every resources, we only give it the person he likes, this and that. And some partners from the states have started drawing back on their promise, saying, and when states say, hey, why are you not doing this? They say it's because of swap. And so with all those things, when we came on board, we felt the first important thing we need to do is to tell our stories ourselves and not to allow anybody to tell our stories. And that was when we now went out for the first state strategic engagement or the roadshows in June 2024, because that was the first attempt for us to go frontally, engage with the states, all of them, and core actors in the state to say, you know what, this is what sector-wide approach is about. This is the reform we are driving. These are the direct benefits you get as subnational entities. And these are the challenges that we all need to work together. And lastly, to say, for the first leg of the sprint, for this year, for the different technical working groups, and for us as a country, these are the immediate things we want to achieve within the next few months.
You took this across the country?
Across the country, to all the states. So that's why we're calling it roadshow, because people will say, oh, are you beating drums? No. But it's because we are really taking the message directly to the front line.
It's a very smart way of describing something technical.
Yes, to make sure that we're not leaving room for information asymmetry as we move into the reform. I think that was very a decisive moment for us to begin shaping the governance architecture, because in that conversation, during those engagements, we laid it clear, how do we intend to govern the reform? What are the structures? How do we expect the states to move? How do we expect the states to organize themselves? And because we are about the states taking up the ownership of this, we're able to move. I think I would mention this here. Not perhaps directly the governance, but remember when we are having the Southeast engagement, we finished going through the lengthy day with all the Southeastern states. And when we closed for the day, I was queuing to get my lunch. One elderly person, I wish I know who that person is now.
You don't know him? It's not like a commissioner,
no.
but he's about
He is a photographer.
Photographer.
He was just busy taking his pictures of participants. As I was queuing to get my food, he came and tapped me. I turned back. He said, my son, this thing you have mentioned is very clear that even myself, I understand it. So for me, I think if that non-technical person, but an important member of the reform, because I said in in governance, the citizens are there. If he will align to it and feels truly this is what we need, I would extrapolate that the technical people in the room would have gotten it. Secondly, I've had conversations with different fora. And in one of them, when we finished, one young lady came and said, Ashiru, I've listened to this conversation. This reform makes me feel proud as a Nigerian because we are taking back what is rightfully ours. And for the states, we could see how from that time on forward, They are always eager to have an interface with us. We ask them, set up your sort of liaison officers, desk officers. And within no time, all the state identified organically someone from the system that they feel will continue to be a champion of this. Somebody that will continue to engage with the different actors, even in our absentia. This is somebody in-house that will continue to preach and help shape those conversations at the state level. And then I think lastly is understanding and seeing how a conversation that almost seemed impossible began to manifest. And that is around how do we organize these three entities to make sure that our plans are really looking forward and to solving our problems. When we were doing the roadshow in 2024, we told the states that our immediate priorities by end of July, for 2024, first, we are determined to make sure all states have their annual operational plans. We are determined to make sure that we set up the performance dialogues, sessions between the commissioners, states, and the Honorable Minister. Because before then, the Minister and the commissioners, who are literally the replicas at the state level, only get to meet to have conversation during National Council on Health.
That's once in a year.
Once in a year. But governance requires a lot to continue, all parties to continue rubbing mind, understanding what are we doing right, what are we doing, what are we not getting right, and what do we need to do better. And then, of course, the conversation around the joint annual review. When we spoke, we said we want to do AOPs. There are development partners that doubted that, are you sure? Because this has never been done. We said, well, so long as our eyes are on the ball, we'll push it through. And Lawal, for the first time, our development partners responded to that power, the governance drive, because we realize there is a lot of verticalization in how things like planning for health happens. Donors, everybody will fund partners. All partners will tell their donors we are supporting AOP. But as of June 2024, only 22 states in the country had their 2024 annual operational plans.
Wow. So the remaining 15 didn't have a plan?
Never. And so you begin to ask question of how are budgeting for health been done? Largely faith-based.
Wow.
And even for the 22, you don't want to ask the quality, when was it done, and what have you, and among other things.
So we solved for the first time.
For the first time.
Ability to
rally everyone.
Have the whole country knowing this is where we are going in next year.
Absolutely.
Even if it's not where we want to get to, but at least there's a sense of direction.
There is a sense of direction as to where we are headed. And we are able to get everybody rally around that direction.
This construct is not usually palpable to citizens who are usually on the beneficiary side.
No.
But for those who are driving investments, either donors or even the guys handling the financial part of our public life, we definitely know that we need this framework to know where to take. If I have 1 naira and I need to spend, I'll be able to say, okay, where is the shopping list? And then let me buy item number 32 on the list. As
So,
opposed to just saying, well, since the Ashiru doesn't know exactly what he wants, I think he needs another cap right
yeah.
now.
So I think for the bigger audience, maybe they will connect with this saying that if you don't plan, you are planning to fail.
If you fail to plan, you plan to fail.
You plan to fail.
Hmm.
So that's what we've been doing as a country. We've
not
not been planning to deliver quality health system.
So you've been failing to plan.
So literally, we've been failing to provide
Plan.
quality health system for the country.
Hmm.
So for all the times you've gone to facilities, the human resources, the commodities are not there. It is somebody's decision that somebody was unable to plan well, and somebody did not provide the resources.
I this is at the point I want to establish that I definitely have to bring you again to talk about the second part of this. And I also want to see how we need to dive into the plan. Maybe I'll bring you with some of your partners that are working on the planning process.
Absolutely.
Because based on my interface with the work you do and the rest of the reform office, I see how that plan is what everything rallies around.
Absolutely.
The partners.
It's the starting point of the reform.
So it means that even for citizens, we talk about attribution. When we say we want to measure, how do you measure the effect of this person's work? We want to now begin to socialize to citizens to look for their health plan. I know that there's been a lot of work in the civic space to drive attention to the budget of the country and how releases and how people are managing the budget of country. But I think we want to use this platform to put equivalent, if not more, attention on the plan. Because
if it's defective,
you can
budgeting is not as important.
As a matter of fact, you can even get resources, but then resources are attacking the wrong things.
Dangerous problem.
Dangerous problem. So you throw in bad money at a wicked problem. So being able to plan, understanding the situation you have in your little environment or your country at large, and coming up with an approach or set of approaches to solve those problems. Then you can start talking about what you want to invest to solve it.
Lawal, planning is not a technical thing, because every day, today, from morning to night, each and every one of us here or back in the
guy selling
community
suya or even
had planned.
The
The
woman in the
guys
market
playing suya, doing grills of suya here, had planned what quantity of meat he would buy, how much firewood, because once there is mismatch in that, then that suya will eventually not be well done, overcooked, or eventually might end up being a failure. When you are getting out of your house, might have planned intrinsically, what do you want to put on? What are the issues? So the same way for the health sector, that needs to be prioritized.
I want to inject one or two more questions, then we'll close. I want to make sure I will land on a challenge, maybe one or two, or let me go the way of swap and say what is the single biggest challenge to the effort.
I think the single biggest challenge in the effort is the individuals, because the reform itself is not it's not a technical reform we're driving. It's a reform that hinges on individuals taking the right decision.
It's a behavioral thing.
It's behavioral thing. Because somebody's decision to sit down and say, you know what? I will go after the right problem.
Mm. I know.
It's somebody's decision that will say, you know what, I would have to make sure that when this partner comes in with these resources, I pause and ask who else is doing the same thing where this is,
Mm.
so that we begin to defragment how resources are put
Spend.
to use.
So Ashiru, the journey of understanding the problem in the society, in the health sector, the right plan, and then transitioning that into the resource conversation is going to be the next thing that you and I will talk about on the next episode.
With pleasure.
I think my biggest takeaway here is, how do we spotlight the plan? Because yes, people want to know about the money, but money is nothing where there is no good plan. And congratulations to you and the team, of course, the whole country, for aligning and agreeing under the state engagement and governance coordination to start producing health plan year on year. We've done our second year now.
Yep.
Thank to God, and hopefully we'll continue to do more in the future.
I think just to say that, though we'll discuss a lot of it next time, but we are hoping that the next layer of the plan that we'll do, we started in 2026, taking the conversations much closer to the facilities and saying, facilities, sit with your community representatives to discuss the issue. We envisage a situation in our country
Where
the next
people-
few years
where citizens
when citizens
will be involved
will be part and parcel
of the
of defining the
plan.
problem
Mm.
and developing the plan from the grassroots to
Oh.
the facility upward.
to the state and the country.
Yes.
I look forward to that.
Yeah.
And so that seems like a 2026, I would say, promise. From
2020 against 2027 plan.
so we do that in 6 ahead of 7.
2027 plan.
Okay, so don't worry. You know my own job here is going to be to call everybody to be part of it. So see, you know who to hold accountable.
Oh,
If
yeah.
you were not invited to the planning in your community, just hold this one accountable. But by God's grace, we'll get it to happen. Thank you so much for joining me. And of course,
Thank
we
you.
look forward to the second conversation.
Thank you.
And
Thank you.
enjoy the
It's
rest
my
of your
pleasure.
evening. Yeah.
It's my pleasure.
Thank you.